Hospitals are the repository of really the clinical, technological expertise and the ability to raise capital. And so now I think hospitals are now moving well beyond mere bricks and mortar, but are really serving as networked hubs for the entire universe of healthcare services. And so I think as we move forward, whereas in my head the visual of a bricks and mortar hospital pops up when I hear the word, I think for the younger generation, they'll think of a hospital as a care provider, where there's a universe of services, including the potential for bricks and mortar, but also information services on the web, complex diagnostics, ambulatory surgeries, on and on and on. The mindset change is incredible, and it's very difficult. But I think as we move towards care in the least acute settings possible, not only are leaders having to think about, do we build or not build, but one of the big issues that has not been dealt with, what do we do with the space that is now freed up in lots of hospitals as we move care to the outpatient side? And that's an issue that really hasn't been solved. And so not only is the mindset change difficult but important, we're going to have to solve some real problems as we move towards more efficient care. The move to provide care in the most appropriate but least acute setting is a wave that's affecting all health systems, and it's certainly affecting Nemours. I think that initially it seemed to be driven by an effort to reduce cost or improve efficiency. But I believe we now know that this serves everybody well. That if patients are kept in a place that is local and not in a facility that is the most complex, as long as their care is appropriate for the condition, the cost is lower, it's more efficient care, and quality and safety are excellent. I think what's been proven empirically and what we now know is that generally improved quality results in reduced cost. And so as we move to finding the most efficient ways to provide care in these lesser acute settings, or care that's local if you happen to be a tertiary care center, tends to serve the patient's interests better. One of the ways in which we can address concerns early is improving access of our families to care providers, to pediatricians, or even to pediatric subspecialists. One way in which Nemours is doing that is what we call Care Connect, and that is a telemedicine effort where patients download an app, and through that app they can access through something like FaceTime, using an iPad or a phone, a board-certified pediatrician or nurse practitioner. They can get their their questions answered using this telemedicine approach. It is a standard fee of $49, and we use protocols that are promulgated by the American Academy of Pediatrics as well as the American Telemedicine Association, such that the care provided is appropriate telemedicine, and those things for which a patient needs to be referred, they're referred right then.